really delighted to be here today in this great facility. Thank you to the hospital staff for allowing us to do this here today, because what we're announcing today plays a huge role within the overall healthcare delivery. So the long and the short of it is, today across the province we're rolling out 30 new family health teams, and the Northumberland Hills application was successful. So congratulations to all in all. I just want to take a minute to thank the folks involved in this. Obviously the docs, you guys played a huge role, and thank you. The hospital, Robert, and your folks, thank you very much. And the physician recruiting folks and all its members, you did a lot of slugging to put an application together that, from what the minister told me, late in the weekend, that it was hard to say no to. So thank you very much. So in the big scheme of things, this will let physician develop, local physician, develop a family health team that best suits the community it serves. It's not a cookie cutter approach. So if you think the application process was rigorous, you've got a lot of work ahead of you. But I know that you're going to be successful. By announcing this here today, I'm really proud to say that family health teams right now cover all of my riding in Northumberland West, with the very first one in Brighton that then expanded to Trenton as well, the Campbellford Family Health Team that's since expanded to Colburn and Warkworth, and now this one here in Northumberland Hills to cover really the west end of the riding. I remember sitting across the table with Dr. Broderick some 5 or 6 years ago talking about this. And knowing the success we were going to have, how important this was, and it took a while to round up the troops together. I think the first meeting I had with Robert, one of the things on the agenda was about a family health team to try to help alleviate the primary health care delivery, that when we don't have that it ends up in the emergency room right near this hospital. So since the application process, which wasn't that long ago, sometimes people think government takes a long time. This was quite was down the pipes fairly quickly, and I've been advocating with the minister how important this was, and I want to thank Art Janinga and Rosemary Robinson. Just as late as a few days ago in Windsor, we sat across the table for Minister Matthews to help me reinforce. So thank you very much for being there and making that happen. So to all involved, a big congratulations and thank you. I'd be remiss if I didn't take the opportunity today to, sometimes we tend to forget, and to have a short history lesson as far as healthcare, because we're not done. We have a lot to do. So some people will lead you to believe that nothing much has happened in healthcare in Northumberland or Quinte West as well. If one would take notice of those blue signs, some people's lawns. But in 2003, when I was very fortunate to be elected, two things that took a lot of our time. One is to deal with the recent loss of a hospital in this riding, and also the lack of family physicians. That staff is here today that can tell you how many calls they fielded in that time frame. So if we fast forward to today, as I mentioned, 3 family health teams have pretty well covered the riding, and we know how important family health teams are in doing the job that they do. We have a brand new community health center in Fort Hope. All 3 hospitals that I have in my riding have CAT scan machines, and I remember the very first one we announced in Trenton, how much important this was for a community, for the hospital, for the cost of transferring patients from one hospital to the other, when you can go in and use that equipment right there. I remember announcing an MRI machine for this hospital some 3 or 4 years ago, and I tell you, staff at that time and management and the board, I put in a real good case, and I'm delighted to say that the minister at that time see it fit that this hospital was worthy of that particular piece of equipment. The other thing that it's worth remembering, and these are now ministry statistics, that in the last 6 years, we've seen an increase in family physicians by about 17% in Northumberland, and an overall 30% increase of all physicians in Northumberland. So, with the enormous amount of, not enormous, but with the number of docs coming to an age probably same as mine, that they probably want to hang up their skates in a short time, I believe the family health team will be a great tool for that recruitment process. Not to mention the fact that some 5 years ago, nurse practitioner didn't exist in the province of Ontario. Now they play a huge role in the delivery, and I'm sure they'll be part of the new family health team. So I'm just going to close by saying that, you know, we hear a lot about cuts. There haven't been cuts. Are we doing these things different? Absolutely we're doing things, and we have to do things different in order to be able to try to meet the demand. So I look forward in the next weeks and months to deliver more good news when it comes to healthcare delivery in this great riding. So I think some of the docs want to add a couple of words to my long, I get so passionate about this, I can't stop. So one of you want to just give us some insight of what this might look like.
Well, first off, I'd like to say thanks, Lou, on behalf of all the physicians. It was really a group effort from all the physicians that work in the Cobourg region, and so 4 different groups got together to put the proposal. Tracy Westall, we had a very good consultant to help us along here. A lot of support from the hospital, from politicians, so I think that helps get it successful. We do have a lot of work. We've got to put together a business plan, looking at how we are going to integrate nurse practitioners, social workers, dietitians, diabetes nurse educators, try to bring all of the necessary skills for family practice, not through the 21st century, expand on what we do as family physicians to provide their service. So we know it's a lot of work to get done. We'll have to look at the documents, see how much time we have to put this together. We hope to be able to bring it to fruition.
I hate to break the news, but I think they want it done in about a year's time. Maybe not complete.
We can do that.
We can do that. There you go. You heard it. You can do it.
Thanks, Kevin.
Thanks very much. Robert, did you want to add something to that?
No, just congratulations to the family health organization, the family practices that have put this application together. This is exceptionally good news for our community and our hospital. And my message right now for our community is that we need to acknowledge and thank our family physicians that continue to support hospital-based work. We're very fortunate for this community. In other communities, family doctors have relinquished their privileges to provide hospital-based work. Not so in this community. My sincere thanks for those physicians. And we see this family health team opportunity as an opportunity to enhance the continued partnership we have with our local doctors. So this is great news for both the hospital, but certainly our community as well. So thanks, Lou, for everything you've done for this application.
Mayor Delaney was supposed to be here, but you're selling your shoes.
I'm coming in today. Thank you very much, Lou. This is absolutely great news. So, all I want to say, I can't add very much to what everybody's already said, but I think it's absolutely great news for Northumberland, and I really believe that a collaborative approach to healthcare makes us not only stronger, but a much, much healthier community. It's absolutely wonderful news for all the people in our community. Also, as being a Cobourg representative on the Physician Recruitment Committee, I know that this is going to make our job easier to recruit people, because so many of the young doctors today want to work in an interdisciplinary environment, and I think that's going to be another way that we can attract physicians to our community. So that's another good aspect of the family health teams. And I just want to add that it was a week ago today that Art Zanika and I were in the Association of Municipalities in China conference in Windsor, and Art was telling me he had a meeting with Deb Matthews, the minister, and we talked about the message he wanted to give her of our family health teams. So Art, you've done a great job with 7 days. But I think it might have been just that little bit of convincing that put it over the top and brought it to fruition. So thank you very much for your team effort.
Thanks very much.